Hello everybody, welcome back to Maxwell and Secret Oompa, and we're talking about dissociative disorders, and we're going to move on to the next part of what I was going to inform everybody of. Again, some of this is coming from the Sidran Institute, so there's a lot of facts in here, and I'm trying to be as factual as possible so that there's not any misinterpretations. So, who gets dissociative disorders? That's what we're going to start off with, and then we're going to go into why are dissociative disorders often misdiagnosed, and then do people actually have multiple personalities? So, who gets dissociative disorders? The vast majority, as many as 98 to 99% of individuals who develop dissociative disorders have documented histories of repetitive, overwhelming, and often life-threatening trauma at a sensitive development stage of childhood, usually before the age of 9, and then they may possess an inherited biological predisposition for dissociation. In our culture, the most frequent precursor to dissociative disorders is extreme physical, emotional, and sexual abuse in childhood, but survivors of other kinds of trauma in childhood, such as natural disasters, invasive medical procedures, war, kidnapping, and torture, have also reacted by developing dissociative disorders. Current research shows that DID may affect 1% of the general population and perhaps as many as 5 to 20% of people in psychiatric hospitals, many of whom have received other diagnoses. The incidence rates are even higher among sexual abuse survivors and individuals with chemical dependencies. These statistics put dissociative disorders in the same category as schizophrenia, depression, and anxiety as one of the 4 major mental health problems today. Most current literature shows that dissociative disorders are recognized primarily among females. The latest research, however, indicates that disorders may be equally prevalent but less frequently diagnosed among the male population. Men with dissociative disorders are most likely to be in treatment for other mental illnesses or drug and alcohol abuse, or they may be incarcerated. That doesn't mean that all men with dissociative disorders are drug users and are incarcerated or anything like that. Men and women both, I think is what it's clearly stating, can have dissociative disorders. It's not specific to a gender. Why are dissociative disorders often misdiagnosed? Dissociative disorders survivors often spend years living with misdiagnosis, consequently floundering within the mental health system. They change from therapist to therapist and from medication to medication, getting treatment for symptoms but making little or no actual progress. Research has documented that on average, people with dissociative disorders have spent 7 years in the mental health system prior to accurate diagnosis. This is common because the list of symptoms that cause a person with a dissociative disorder to seek treatment is very similar to those of many other psychiatric diagnoses. In fact, many people who are diagnosed with dissociative disorders also have secondary diagnosis of depression, anxiety, or panic disorders. I myself went through probably 5 or 6 years of treatment for depression before I actually got the diagnosis. So that is common. Do people actually have multiple personalities? Yes and no. One of the reasons for the decision by the psychiatric community to change the disorder's name from multiple personality disorder to dissociative identity disorder is that multiple personalities is somewhat of a misleading term. A person diagnosed with dissociative identity disorder feels as if he or she has within them 2 or more entities or personality states, each with its own independent way of relating, perceiving, thinking, and remembering about him or herself in their life. And 2 or more of these entities take control of the person's behavior at a given time. a diagnosis of DID can be made. These entities previously were often called personalities, even though the term did not accurately reflect the common definition of the word as the total aspect of our psychological makeup. Other terms often used by therapists and survivors to describe these entities are alternate personalities, alters, parts, states of consciousness, ego states, and identities. It is important to keep in mind that although these alternate states may appear to be very different, they are all manifestations of a single person. I don't like the word manifestations. That's just me, though. I call the others inside of me I usually call them parts, because I see them as part of me. But that's just me. Everybody is different. Everybody with DID or dissociative disorders deals with things a little differently or has their own opinions and their own ways of dealing with things. So what I may say works for me may not be the same with what works with somebody else. Can dissociative disorders be cured? Yes. Dissociative disorders are highly responsive to individual psychotherapy or talk therapy, as well as a range of other treatment modalities, including medications, hypnotherapy, and adjunctive therapies such as art or movement therapy. In fact, among comparable severe psychiatric disorders, dissociative disorders may be the condition that carries the best prognosis if proper treatment is undertaken and completed. The course of treatment is long-term, intensive, and invariably painful, as it generally involves remembering and reclaiming the dissociative traumatic experiences. Nevertheless, individuals with dissociative disorders have been successfully treated by therapists of all professional backgrounds working in a variety of settings. And with that, I just wanted to reiterate that this information is coming from the Sidran Institute. I've got a couple other books that I will be reading from, and I will link them to the YouTube site as I use them. So I guess with that I'll end this series. I hope that there's some information that people have been able to take from this and learn and realize this isn't a joke, and people are really working hard with these disorders to do things good and right and to be healthy for them, whatever that means for them. And we just are looking for support, good, honest support, and not looking for people out in the world to think that we're crazy or that something is totally wrong with us. It's what we had to deal with and the way our minds developed based off of our past, whatever that may be. And I hope that this awareness or this video will bring that awareness. And I hope these videos that I continue to do will help bring awareness to what it really is. Alright, so Maxwell, say goodbye. Okay, he just said goodbye. And maybe some of his friends will join at a later date. He's talking about wanting to have a friend with him. So we'll see. For now, take care, and I'll see y'all in another video series. Again, please don't hesitate to ask questions. Thanks.